Firstly, have you ever had hypertension, asthma, or diabetes?
My blood pressure is a little high.
What is your usual blood pressure?
140/90 to 100.
Are you on any medications?
Yes, I'm taking one type.
Do you know the name of the medication?
Yes, it's Renovase.
Did the hospital prescribe you the medication? Other than this medication, are you taking any other medications, for example, supplements?
Yes, I'm taking blueberry extract for my eyes.
Okay, please stop taking the supplement medication 1 week prior to the surgery.
Why's that?
We cannot predict what kind of drug interactions your supplement might have, so it is safer to stop the medication prior to surgery.
I understand.
Firstly, have you ever had hypertension, asthma, or diabetes?
Yes, I have diabetes.
When were you diagnosed?
5 years ago.
Are you taking any medications?
I'm not on any medication.
Do you see your doctor regularly about your diabetes?
I went once, but after that I haven't been.
I see, I understand. One of your blood tests we test for diabetes, the hemoglobin A1C came out at 6.4%. The normal value for this blood test is less than 6.0%, so your sugar control is mildly impaired.
I see. Should I be taking oral medication? I don't want to take oral medication if I don't have to.
I will discuss this with the physician to follow that up. For this surgery, it shouldn't be a problem. Firstly, have you ever had hypertension, asthma, or diabetes?
Yes, I have asthma.
Do you see your doctor regularly about your asthma?
Yes, I do. And I was prescribed an inhaler.
How many years have you been using your inhaler?
For roughly 2 years.
Please tell me the name of your inhaler.
It's Symbicort.
When was your last asthma attack?
2 years ago. The attack occurred suddenly. However, that was the only time I ever had an attack.
Did anything trigger your asthma attack?
I was told it was triggered by a pollen allergy.
Have you ever visited the emergency department because of your asthma?
No, I haven't.
Can I have a listen to your lungs? Can you please face the other way and lift your shirt up? Close your mouth and a deep breath in and out. Another deep breath in and a deep breath out. Okay, your lungs sound normal.
I haven't had any problems recently.
From the results of your breathing test this time, your values were a little lower than expected, which is probably a result of your asthma. At these levels, there should not be a problem with your surgery or anesthesia. However, just in case, I will refer you to the lung specialist at our hospital for a consult before the surgery. Please continue to use your inhaler until the morning of the surgery.
I understand.
Have you ever had any allergies to medicines or foods? In other words, have you ever felt ill or had a reaction to any medicines or foods before?
I have hay fever. Also, previously when I took antibiotics, I broke out in hives.
Do you remember the name of that medicine?
I don't remember. It was when I was a child. After that, I've never had any similar episodes.
Have you ever had any reactions to painkillers such as Loxonin or anti-fever medications?
No.
Have you ever had a rash to alcohol wipes or tapes?
When I use alcohol wipes, my skin becomes red. Also, after using tapes or plasters, I become very itchy, so I don't often use them.
Okay, we won't use alcohol wipes. During anesthesia and surgery, we will need to use different kinds of tapes and plasters. Sometimes we will need to use a strong adhesive tape. For example, to secure the breathing tube, we use a strong adhesive tape that tapes to your face. We do this because movements of the breathing tube is dangerous during anesthesia. When the surgery finishes and we remove the breathing tube, this tape will be peeled off your skin. However, sometimes there may be some damage left to your skin afterwards.
Does that mean my face might be scarred?
There is that possibility. To try and prevent serious damage to your skin, we apply some protective solution to your skin before sticking the tape down. We also use a tape removal wipe before removing the tape. Even so, please understand there is still a possibility that the skin may peel a little bit.
I understand.
In addition, we may need to use tape to secure the drip. We will try to use skin-sensitive tape.
Thank you very much.
Have you ever had medical problems with your brain, lungs, heart, liver, or kidneys?
2 years ago, I was told I had angina. I had chest pain suddenly, and when I went to hospital, I was admitted. That day, I had a coronary angiogram and a stent was placed. I'm still taking medication now.
Do you go to the hospital regularly in Japan?
Yes, I go for a checkup and receive medications every month.
Have you had a coronary angiogram recently?
I had an angiogram in Paris last year, and they told me the stent was fine.
From the ultrasound of your heart we performed, the heart and heart valve function are normal. I don't think this will be an issue for your surgery or anesthesia.
That is reassuring.
As a surgery, this time is for ureteric stones. We won't stop your blood thinning medication for the surgery.
I understand.
When you have a chronic illness, sometimes the effect of surgery and anesthesia can make the chronic illness worse. In your case, it is heart disease. If during the surgery anything goes wrong, we will treat it straight away.
Thank you very much.